Hello, this is Karen Sanders. It's my great pleasure to speak to you today about the Holistic RN Patient Advocacy Training Institute and the course Start Your Own Holistic RN Patient Advocacy Practice. I'd like to just talk a little bit about how do I find clients and how does this work while being in private practice. So one of the very strong things that happens with me here in Asheville, North Carolina, is that I've been here for 34 years. I've hired hundreds of nurses, and my networking is very extensive. And the example that I would give you would be that there are nurses here who are employed in hospitals, physician practices, assisted living, skilled facilities that know me and have worked with me, and they in turn actually refer me to patients who are hospitalized. As a matter of fact, today I have a client that's called me that is in the hospital that's having some serious difficulty, and she has been referred to me by a nurse on staff on which the client is located. So we can't ever underestimate the power of clients finding us through our extensive networking. Also, people will find me by using the internet, and they will find me by having strong connections to their professional organizations statewide and nationally. And I would say, though, one of the best ways that clients find me also is by my teaching complimentary classes all over our community here, and especially in the Osher Lifelong Learning Institute, which is located at the University of North Carolina in Asheville. So I've been teaching free classes there for 6 years, and the class is called Becoming an Informed Consumer Advocate for Your Own Healthcare. And it's my great pleasure to offer my free classes to students, to elders who are facing all kinds of medical and healthcare challenges as we all gently age. So you too can have a very strong network. You too can develop your own private practice as an RN patient advocate, and you can start small by creating a website and then start telling everybody you know that you've started this business, and it is your great pleasure to work as a nurse and to do what we've all been trained to do, is to use our great nursing judgment in terms of the nursing process with assessment, plan, implementation, and evaluation in helping us work with our clients to find out what's the most important thing for them to be helped with. So those are that's my introduction to you all today, which is Sunday, July 17th. And are there any questions that anyone in the audience has today? I'll just wait a second.
What can students expect during the Training Institute?
So Mark has asked, what can students expect during the Training Institute? So the Institute starts on August 17th and goes till January 11th, 2023. It is a 2-hour course that happens every Wednesday for 4 months roughly, and the class is on Zoom, and we have a huge curriculum that we offer over those 4 months. This course has been approved by the American Holistic Nurse Association for 35.9 contact hours, and we offer courses. We offer lectures by 20 adjunct specialists in their own fields, such as the U.S. healthcare system, in places like home care versus home health. We have a fabulous set of physicians who come in and talk about things like COVID. We have physicians talking about palliative care. We have speakers talking about how to start your own business. We have speakers talking about creating your fabulous website, what's entailed with that website, what are all the steps you have to do to start a website. We have all kinds of different speakers talking about how to navigate the healthcare system using people like long-term care ombudsman, and we offer all kinds of techniques for you and strategies for you to start your business. What is a one-page business plan? How do you start a limited liability company? What are the major provisions of your Nurse Practice Act? How do we adhere to those provisions of our Nurse Practice Act while we are in private practice? And those provisions are going to be different state by state. So, in summary to that question, we are going to meet for about 4 months. It will be about 20 classes for 2 hours each. It's been approved by the American Holistic Nurse Association for 35.9 contact hours, and we have about 20 adjunct speakers speaking on all kinds of content. We also have a speaker coming in talking about the importance of looking at and working with patients from a holistic coaching perspective, and that would be a lecture offered by Dr. Linda Bark, who's the owner and founder of Wisdom of the Whole Coaching Academy, and she does a great overview of that content. Lastly, we focus on you as the learner and what kinds of things as you as the learner and you as an experienced nurse need to know about yourself as you go into this whole journey as an RN patient advocate. We talk about what for you to identify which one or several of the 5 different intuition types are you, and how important it is for us to focus on those intuition types. We also talk about the ACEs scores, that's the Adverse Childhood Event scores. We talk about those kinds of things in terms of being focused on our internal landscape as we work with patients. So that's the answer to that question. Mark, do we have any other questions for you?
So once the class ends, how do they earn money? What's the process there?
So after you finish the class, one of the things we talk about, there's a whole lecture on establishing your hourly rate as an RN patient advocate. So for me, I had to do a little literature review about what the hourly rate was for an RN patient advocate in Western North Carolina. So having had students all over the country, from California and from Oregon, from the Midwest, Northeast and Southeast, and Florida and Texas, what is an hourly rate for an RN patient advocate? So we talk about finding that hourly rate. For me, I charge an hourly rate of $100 an hour, which is about right for this region. In the Northeast and the West Coast and in Florida, it's going to be higher. So it's important for you to kind of be aware of how do you set your fees and how do we make money. So the other thing I do is I always give prospective clients my first hour of RN patient advocacy at no charge. And then after that, we talk about how can I help them and are they interested in establishing a relationship with me. Thanks. Okay, Mark, what other questions are there?
So what kind of investment does it take for a nurse to step into this?
So the investment that a nurse has to make is to, of course, pay your tuition for our course, which we also offer a payment plan. And then the way we set up the course is that you can continue working full-time or part-time after the course is over, so that you have income coming in while you take those little steps to create your practice. So one of the things I did is I worked part-time as an adjunct faculty at a nursing school, so I could work part-time while I established my business. So that's what I did. I worked part-time so I could fund my purchase and my expenditures of some of the things I needed to do. So the first thing I needed to do was to work with and pay for a fabulous website designer so she could help me and work with me and hear my business plan and all of the things, all of the positive energy I wanted to put in my website. So I started small, I started shorter, so that as my practice grew and more patients sought me and paid me, then I would continue to drop my hours little by little, so that eventually I went full-time as an RN patient advocate. Thank you, Mark, for that question. What other questions do you have?
So we're experiencing broadband issues. It's a little glitchy. So we have a guest that's asking to post the video afterwards, which we will do. We also have one of your assistants here in Asheville that's online. She's part of the support network that you have. Can you tell us more about your healing network, as you say?
Sure. So one of the topics we talk about in class is to establish a healing network for you as an RN patient advocate is starting your own private practice. So for me, a healing person to be in my network is someone who has really positive energy and someone who will look at me from a mental, physical, spiritual, emotional, environmental, and financial perspective and give me positive strokes about how I can improve the work I'm doing and how I can do it successfully. So I have a wonderful accountant, great positive energy. I have a fabulous bookkeeper, a fabulous IT person. That's Mark Zarnecki, who's helping me with this. I have two great assistants. That would be Jenna and Corey, who have great energy, who help me answer multiple questions about my practice and about my website. I have a fabulous web designer named Sarah Benoit, who is incredible in her energy and her kindness and working with me. And I have many other folks. I have a fabulous business plan developer. His name is Gary Heisey. He lives not too far away. So I've been blessed with a wonderful healing network. Thanks for your question, Jenna. Are there other questions?
Tell us about some of the success stories that we've had throughout this cohort.
So I've been touched by the lives of approximately 30 students who've taken this course in the last 3 years, and they're amazing stories of starting their practice and getting involved in the world of patient advocacy has been wonderful. They've made changes in the lives of many patients, and some of them have some of them are still working in their jobs part-time while they are growing their businesses, but they've all had tremendous impact on their communities with volunteer classes as well as seeing patients. And so I'd be delighted to give you some of their names. If you'd like to contact me, you can call them on the phone and talk to them about their own experiences. And you can call me on 828-295-1140, and they would be happy to speak with you. And once I get their permission, I could give them your cell so you could contact them individually.
Okay, so we continue to have some slight broadband connectivity issues. It's a little fragmented. As we're bringing this to closure, do you have any closing comments to indicate?
I would just say that our healthcare system is fractured, silo-driven, technologically impossible, and very difficult for our patients to navigate, our patients and families and loved ones to navigate. And I think just here in Western North Carolina, we need about 100 patient advocates, and that would allow advocates to be involved and have connection to everywhere or along our healthcare continuum, which would be pre-admission, which would be available to help people navigate minute clinics, urgent care centers, ERs, hospitals, physician offices, skilled facilities, assisted living, independent living, hospice, and palliative care. We need many, many people, many, many nurses. I believe nurses are the most qualified, the most tender-hearted, and to be holistic patient advocates. So I think it's wonderful.